Amandra. Amandra.
Thank you.
Viva Africa, viva.
Viva.
Viva Africa, viva.
Viva.
Yeah, again, today is a great day for Africa to meet through virtual. And it's very, very sometimes discouraging because we are used to meet face to face. But these days is through Zoom meetings. President Mato, General Secretary Elizabeth Tang, our leaders from Africa affiliates, our partners from different areas who have been supporting us, you are welcomed warmly to listen to this meeting or to the report on the impact study on COVID-19 in Africa. Can I get my paper? Hello? Hello, Clara, can you send me my paper?
Yes, I apologize. Let me share my screen.
Yeah.
Sorry, 1 second. Can you see it full screen?
Yes, yes.
Okay.
Yeah. I'm going to do the introduction about the impact of COVID-19 on domestic workers in Africa. This has been a global issue now, and for Africa through the support of IDW. Clara? Clara?
Yes, can you see the second slide?
Yeah, yeah. Yeah, COVID-19 has affected very much domestic workers in Africa, like any other regions. But in Africa, it may be worse because of the working condition, the environment situation, which are existing to our affiliates or their workplaces, but also to the economic situation of Africa. Therefore, IDWF took a very historic role to support the domestic workers through the humanitarian support. And this was done in 2 phases. The support was given in 2020, that is between May and July. And the second phase was done in October and December. The support was done to 26 domestic workers unions in Africa. The domestic workers were supported with the food packs, masks, sanitizers, but others used the fund to develop awareness about the prevention of COVID-19, because most of them did not know as it is a new disease. Next. A total of 14 countries were involved in the study. The countries which were involved are as follows: Francophone. Also from Portuguese, we had only one country, Mozambique, because in Portuguese, for Portuguese, we have only one affiliate. For Anglophone, who are English speakers, the study involved the Kenya affiliates, Siau, Kudeia, Malawi, Siau, Namibia, Ndau, South Africa, Sadao, Uganda, HTS, Tanzania, Chodao, Zambia, Domestic Workers Union, Workers of Domestic Workers Union, and Ethiopia, the MTDA. What were the criteria used? affiliates which has many members. Therefore, we had to identify who should be involved because we have 26 affiliates. Therefore, we looked at those affiliates with big numbers, with large membership. And this included Kenya, Tanzania, South Africa, and Mozambique. Also, we looked at the affiliates who have medium membership. And this included Burkina Faso, Guinea-Conakry, Ethiopia, Malawi, Namibia, and Uganda affiliates. But also we looked at those affiliates with low members, but are very active. Therefore, we included our affiliate in Zambia and Senegal. Next. Training of the interviewers. This was the first study of its kind, which involved the domestic workers themselves. In many cases, the study or the interviewers will be the academicians or the researchers or students from the university. But this, for IDWF, it was a very unique. We involved the domestic workers themselves. Therefore, in order to do, and it was their first time to do the interview of the research. Therefore, we had to do the training. A total of 3 trainings were done before the study. The training objectives was to first to go and familiarize with the questionnaires. And also, this could help the domestic workers who were doing the interview to add some of the issues which they wanted to be included in the study. Therefore, on 10th October, there was a training for Anglophone, where 22 affiliates, leaders, and organizers participated in the training. On the 11th October, a training was done to Portuguese, whereby 6 leaders attended. But also in the afternoon, the same day, a training was done for the Francophone affiliates, whereby 15 domestic workers leaders attended. And hence from there, after compiling all their edits, their comments, the survey started on the 9th January 2020 to January, on the 9th November to January 21st. Next. As I said, this was a special study. Domestic workers, after getting the training, they did themselves. They interviewed the domestic workers themselves. And it was a very good relationship because domestic workers, leaders, and their members were very, very close. The domestic workers were not even afraid to respond to the questionnaire. First of all, because they are working together, they have similar languages. The language communication was very easy. Here you can see a photo from Burkina Faso. Domestic workers are interviewing their colleagues. You can see here the General Secretary, Mr. Nana from Burkina Faso. They were using their cell phone, of which initially it was not the case for our members or our leaders to do interview through mobile, but through training, they were able to do so. Next. Is there another showcase here? You can see Mozambique. Rosa, who is the organizer, is interviewing a domestic worker leader. And she's using a laptop, which was not the case initially, to do the interview. You could see the first one, they were using mobile, but this one, now they are using a laptop. On the right side also, you could see domestic workers from Senegal below. They are also interviewing domestic workers. Next. Here also, Mozambique, the General Secretary of Mozambique, Maria Joachim, is interviewing a domestic worker using a mobile. For us in Africa, that is one of the development. Domestic workers interviewing their colleagues or participating in the study, but also using the mobile and the PC or laptop, which was not the case initially. Next. Yeah, what I wanted to say, it was through the training that the domestic workers were able to use their mobile and their computer to do the interview. And this is, I think, is one of the best practice for domestic workers, for leaders, for members to be involved in the interview, of which I think sometimes you can get good results from the interview or from the study. Thank you for your attention. Yeah, after I'm also the moderator with our president. This was just an introductory to welcome, but also to speak about what type of the study we did, how we did it, and for whom we did it. I would like now to welcome President Mato to give the remark. Welcome, President Mato.
Myrtle, you're muted. Myrtle, you're muted.
Okay, can you hear me now?
Yes, very good.
Okay, good day, everybody. It is my pleasure to be here on this lovely Friday afternoon, evening for some of us, to welcome you to this lovely webinar where we will discuss and look at what happened in Africa. A special welcome to our comrade Elizabeth Tang for always being there and supporting Africa, giving up her time at night, especially with everything that's happening in her life. We salute you, comrade, and we wish you strength for what you're going through. I thank you all for being involved in this, but I think what it has bring up is how domestic workers are suffering. It brings up the lack of support for domestic workers within our own governments. It brings up how our governments again sideline domestic workers with COVID funding, with grants and everything. But through it all, the International Domestic Workers Federation has shown the world that we are united and we will support wherever we can. And that we have tried to support Africa, we have tried to support the world. But there is much more to be done. There is much more that we must go forward. Now we have to work on our sustainability fund. We have to work on projects to strengthen our unions, to strengthen our organization. And we can only do this if we stand together. In South Africa, I was very proud of how they conduct the research. They had headaches, they were crying, they were in tears. But through it all, the 5 of them has done a wonderful job. And all over in Africa. So as we go forward into this now new world that will stay with us for a long time, we hope that we will unite, we will strengthen each other, we will pick each other up if we fall, and let us Show the world and let us ask funders support us in any way possible, because we need solidarity and we need all to stand together. Today, the COVID-19 funding will stop in South Africa. Yet domestic workers has been left out. Tatsawa has been part of this campaign. We speak on TV this morning. We're going to speak this evening again to say, don't stop this funding and help domestic workers to at least have some income. I wish you luck. Thank you, Vicky, for always being that strong coordinator in Africa. We are 100% behind you. Thank you, all of us, Dio, all of you in Africa. We are 100%. Met for being here and hosting this. Thank you very much. I salute you all, and like Elizabeth said, Amandla, power to the workers in Africa.
Amandla, thank you very much, President Mato. As you always speak for domestic workers, you have said that still domestic workers are suffering, and you are urging the funders, the partners, to continue to support domestic workers. But with the emphasis is also saying that we need to continue to remain united, to become strong. Thank you very much for your powerful words. Now I would like to invite the General Secretary, Elizabeth Tang, who have been behind of this all IDWF work. As Mato said, she has been very strong to make sure that domestic workers are becoming strong, domestic workers organizations are becoming stronger, and they are getting support on different issues. Welcome, General Secretary Elizabeth.
Thank you, Vicky. Good day, good afternoon, all my sisters, brothers, for inviting me to these important activities to hear what has been happening in your country, in your community under the COVID. This research has been going on for a few months since last December. I'm very, very excited to see the baby finally is born. Throughout the last few months, I have seen photos and I also have heard reports that how hard you have been working to get the replies, to get all the answers, to finish, to complete the survey questions, which are so important to make the final report. And I have been hearing so many times and from so many domestic workers that, we don't know why research. We are tired of talking to academics, people who just come and ask questions and take a lot of time from us, and they said they write reports, which we never see. And I want to assure you that this is not the case. The whole objective of doing this COVID impact report is to give us a tool so that we can continue to fight for our rights and for our social protections. Because we need people to listen. We need governments to listen. We need people of parliaments to listen. We need employers to listen. We need everybody to listen to us. And people will remember what we say if they hear us saying with numbers. When they hear the numbers, then it's easy for them to imagine how serious the problems are. And this report is very, very powerful because the report is by us, by the domestic workers, by you having talked to so many domestic workers around you. So this report is very, very powerful too. So I wish you luck, and I want to assure you that IDWF will be together with you and use this report as a tool. Now we have an additional tool to fight until we get our rights, our social protections. Tomorrow, May 1st, is the International Domestic Workers Day. It's the International Workers Day. And we are workers, so it is our day. And the IDWF will remind the world that social protection is a must. Especially now we have gone through the COVID. We don't want to live the same way. And governments must implement laws, must implement regulations to make sure social protection is here for domestic workers. So let us be together and unite, as our President Myrtle has said, so that we will win. Thank you very much and have a good meeting.
Thank you very much, General Secretary Elizabeth Tang. You have given the domestic workers the homework. First of all, the General Secretary has reminded us and all leaders of the affiliates that the research is a tool for us to continue to advocate and pressurize the government for social protection. But also, she has reminded us on the May Day is a coincidence now for us also to use this research report to lobby, to pressurize the government, and to showcase when we are marching, when we are doing our events before the policymakers. Thank you very much, General Secretary. Amandra! Amandra! Yes, after our General Secretary, I will invite, I don't see. I will invite Luis. Luis. We had two researchers, Luis and Ruth. Unfortunately, Ruth was supposed to be here, but she's presenting her thesis in this moment. Therefore, she has apologized, and all the work will be done, the presentation will be done by the chief researcher, who is Luz. Luz, welcome.
Thank you, Vicky. Bon dia, bonjour, good morning, or good afternoon, good evening to our comrades in Hong Kong. Thank you so much for inviting me to be with you once again. This is such a pleasure and an honor to be here with you today. Like Vicky said, I was supposed to share the presentation with Ruth Castelbranco, who is a researcher from Wits University in South Africa, and she's submitting her thesis today. So we hope she will watch us later on. And Ruth, all the best with the thesis submission. Ruth is the regional expert on Africa, and she's the one who put the report together. I did the data analysis, but she's the one who brought everything together in the report. So she's been a very important person in this project. I also wanted to say that this is part of a global project from IDWF. Similar research has been conducted in the MENA region and in Latin America, and it's been such a honor and a pleasure to be with you in this journey. Thank you so much. So now to the results. Okay. So like Vicky, Myrtle, and Elizabeth said, this research really aims to support the unions and to support IDWF. So at the local, national, international level, you have more tools to fight. So we wanted to really understand what was the impact on domestic workers' conditions, what sort of state support domestic workers receive, or as we will show, did not receive, what sort of alternative measures or actions domestic workers took in the absence of state support, and what was the impact on their occupational health. Oh, sorry, just 1 second. I have emails coming in at the same time. Okay, sorry. And then what was their experience and the role of the unions in this pandemic crisis. So very briefly, because Vicky said already, there were 14 African countries involved in the research. And I just wanted to stress once again that the data was collected by the affiliates, by the unions themselves. And this was so important. And I think it made the research much stronger, and also provided the unions with new tools to organize. So although we provided the training with Ruth, the work was really done by the unions and by ADDWF affiliates. And I think this is what makes this report so unique and so important, not only for data, but for the whole process and for strengthening the movement. Few demographic characteristics of the respondents. So 65% live in urban areas, 24% are national migrants, and 6% are international migrants. Absolute majority are women, like in most regions of the world. 85% are the main breadwinner of the household. And for the absolute majority, domestic work is the main source of income. So this is very important because it means that any loss of job or revenue will impact them and their families in a very hard way. Prior to the pandemic, informality rates were already very high. So 81% said they did not have a written contract, and 69% said they did not have access to social security. So the absolute majority was already lacking protection even before the crisis started. And then once the lockdown measures started and the restrictions started, this is how it impacted their employment situation. And we asked the same questions in the other regions where IDWF conducted the research. So as you can see, about a third were suspended or fired. 18% kept working, but with a reduction in hours and wages. 47% continued working normally, and only 6% could stay home receiving their salary. So this is a very small proportion who benefited from some support from the employers. 47% continued working normally. On the one hand, we could see this as something positive because it means they didn't lose revenues. But on the other hand, it means that they were highly exposed to the risk of the pandemic. It means they kept going to work every day, they kept taking transports, and we will see just after that their working conditions were not good and not decent at all. So it's not such positive result in the end to have them working in the middle of the pandemic crisis. Of course, because this is a very highly informal sector of activity, it means that they were hit in a very specific way. So as we just seen, about half of them had a reduction in their income. If we don't have time to discuss country by country today, but the countries that had more strict measures had also the biggest impact on loss of employment. Amongst those who lost their employment, 85% said that they did not receive severance pay or unemployment benefits. It means that those who lost their employment, they had almost no support and no resources at all. It took up workers about 6 months to find a new employment. Of course, the reduction of income had a dramatic impact on the whole household. Like I showed at the beginning, the majority of them were the main breadwinner, and this was their main source of income. And on top of this, they all reported additional factors of crisis, such as the rising price of food, of fuel, and other expenses, at the same time as their salary were being reduced. Quite dramatically, we saw a lack of state support, and the leaders who will speak right after me will explain with specific country cases how this has affected them. But so only 30% of them continue to have some sort of social insurance scheme. Many African governments did introduce some income support measure, but those usually excluded domestic workers or only targeted a very tiny minority of worker on a very low income and missed the domestic workers. And quite importantly, over half of the respondents say that they did not even apply to the government support scheme because domestic workers were not included in that scheme. So they couldn't even try to get support from the government. Overall, of the 3,400 respondents, only 17% of domestic workers received some form of state support. And this is very unequally spread across the country. So in some countries it's 0%, while in some others it's slightly higher. But overall it's very, very small proportion of the respondents who could get some support. This is a quote from one of the leaders who took part in our feedback workshop, and they said, there were no specific measures for domestic workers. If workers received benefits such as sanitation kits or a waiver of utility fees, it was because they happened to be in a household that was included in the program, not because they were a domestic worker. So this is very important. There were no or almost no targeted measures for this workforce, although it's a very important part of the population and of the working force. This is results by countries. Of course, I don't have time to go into details, but it's just to give an idea of the sort of support scheme that were introduced by governments. So some introduced cancellation of water and electricity bills. So you can see this is mostly Senegal and Togo. Emergency financial aid, virtually none of them. And as you can see, in most countries, 0% got such a public support. Food basket or food vouchers, mostly Uganda, very little in the other countries. Unemployment benefit, seems that only respondent from Namibia could get unemployment benefit. And support for rent in Burkina Faso, but that was the only case. And most importantly, this part here, the nothing. So those who received nothing from the government is the absolute majority in most countries. And we will hear in a little bit about Mozambique, where absolutely all the respondents, 100%, chose the option, I did not receive anything. So in the absence of state support, how did they survive? So some of them borrowed money from friends and relatives. Some of them had to move back to parents or relatives' house. A small proportion said they turned to rotating saving groups. About a third said they used their personal savings. About 10% started selling homemade products, such as food, masks, clothes, and 13% said they contracted a debt or a loan. Quite importantly, a majority of the respondents, 67%, so quite important proportion, mentioned that they received support from their union. And this is something I will comment again a little bit later on, but I just wanted to really emphasize that and emphasize again the role of the unions and the support that IDWF gave to the affiliates. So again, a quote from one of our participants. During COVID-19, we were locked in, no visiting families, so it was impossible to borrow food from your family because of hunger. From this period of COVID-19, I learned that even your immediate family could not support you when you have a problem because everybody was just looking after themselves. Finally, some data on health and safety. So even though by the time of the study, a great majority had already returned to work, 58% said that they felt either unsafe or very unsafe due to the lack of personal protective equipment, safe transportation, and the intimate nature of domestic work. So the majority is back to work, but they feel very unsafe going back to work. The majority also does not have access to paid sick days. So you can imagine that in case they contract COVID-19 or another disease, they will have to choose between salary or their health. Given the stressful nature of domestic work, we also saw the prevalence of many pre-existing conditions, including, for instance, high blood pressure, respiratory disease, or diabetes, which are all conditions that are said to be worsening factors of risk for COVID-19. Of course, the risk of contracting the disease or having their health affected was worsened by the overall deterioration of healthcare services and difficult access to medication. I think I don't have a lot of time left, so I won't go into too much details, but I just wanted to show you the prevalence of high blood pressure, which is about a quarter of our respondents. And this is quite significant because it's one of the conditions that can worsen COVID-19. For those who kept working, 75%, so again, a very large majority said that they had to work more than usual. 20% was forced to stay at the employer's house during the lockdown. So quite important violation of rights here. And 6% declared that they had to take care or work with someone who got COVID-19. So a quite important factor of exposure and risk to the health of domestic workers to be considered. Lastly, I wanted to say something about the role of the unions. So IDWF raised funds at the global level to support the response to the crisis, and most of the money was used to distribute food baskets and hygiene kit products throughout Africa and the other regions. And so those are some pictures of actions for the affiliates in Africa. And as I mentioned before, the majority of respondents mentioned this direct support from the unions and how important that was, because in the lack of state support, adequate public policy, lack of access to social security or unemployment benefit because of the informality rates, the role of the union became even more important. So, of course, unions did a lot of things, such as providing information, representing workers, but they also had to respond to the humanitarian crisis. And I think this is such a fantastic work they did. And I'm sure the three speakers after me will talk about this a little bit more. But it was really a moment where they really came together for the membership and supported them through this hard time. And so I just really want to emphasize that and say how much I admire the work that they did through such a difficult moment. To conclude, a few recommendations that we put together with the affiliates. So first of all, for the state. So those are the demands that came out from, we did a feedback workshop with the affiliates before finalizing the reports, and those are the main recommendations that came up: awareness raising campaigns regarding occupational health and safety standards, worker rights and employer responsibilities, distribution of personal protective equipment at key access points such as bus or taxi ranks to make sure all the workers can get access to them, price controls for food and basic goods, expansion of emergency income support measures to include domestic workers, extension of contributory social insurance to domestic workers, so to mitigate the effect of informality, introduction of an unemployment benefit scheme where it is absent, ratify conventions 189 and 190 where this is not the case, and adapt the national legislation, and improve access to medical assistance and safe public transportation for domestic workers. Recommendations for unions: keep doing awareness raising campaigns on occupational health and safety, expand membership and source of revenues to continue the work that was done during the first and second wave of the crisis, and the distribution of emergency funds and products such as food and hygiene products. Expand the training programs that include raising awareness about rights, leadership development, and income generating workshops to find alternative solutions in case of crisis and unemployment like the one we are witnessing. Campaigns to pressure the states to ratify ILO conventions 189 and 190, and adopt complementary legislative reforms, including effective expansion of social protection to domestic workers. In the report, there are also recommendations for the employers, so I invite you to read them afterwards. And I leave it here. We have 3 speakers next to give more concrete details about what happened in their countries. And to conclude, I just want to thank you once again for this great opportunity. Thank my colleague Ruth, who isn't here physically, but is here with us in her thoughts and in her great support and work in this project. Thank you, Elizabeth. Thank you, Vicky. Thank you, Myrtle, for trusting Ruth and myself with this project. And thank you to all the affiliates I got to know. It was the first time I worked with Africa, and it was such a pleasure to meet you all. And I hope I'll see you again in person, not online.
Thank you very much, Luis, for the good presentation. And maybe I can replicate what Elizabeth said. It is a tool. In this report, you could see what has happened or what is happening to our countries with regard to domestic workers. But also it has shown what is the state, the recommendation to the state, what the state is supposed to do. But the state cannot do it without our push. Therefore, we need to lobby. We need to pressurize the government. But also as affiliates, what are we supposed to do? Therefore, the report has been very detailed, and we are going to share with you. All this report we are going to share with you in all the languages which we are using in Africa. As Luis said, there are some good practice or some experience from different countries, but we thought we could select 3 countries. And I would like to invite Asma Bai, who is the member in the IDWF Executive Committee representing Africa, but also she's one of the strongest leaders in Africa. And she's the General Secretary from Guinea, from our affiliate CINEM in Guinea-Conakry. Welcome, Asma. Is Asma around?
Asma seems to be off for this moment. Maybe let us do Gloria first.
Gloria. Okay, Gloria is with the organizer from South Africa. She has a lot of experience. and she participated well in the interview. Therefore, we are going to get some of her experience of what could be done or what they are facing. And they were very good on social security, social protection. Welcome, Gloria.
Good day, everyone. I would say I thank you all to invite me on this meeting. First of all, I want to say my General Secretary, Natal Valkoy, already mentioned that we are sidelined by our government. 3 days ago, we were celebrating here in South Africa our Freedom Day. But still, the domestic workers are not equal like other workers. During this COVID-19, workers lost, many of them lost their jobs. And also, they couldn't have an access to the provision that was provided by the government. So they lost, they were staying in the poverty, and they were not getting any income. What we did at Satsau, we did a research, and we find out that the inequality is still there because the domestic workers cannot get any provision from the government. So we are helping them now to apply because they don't have any access, they don't have smartphones, they don't know how to fill in the form when they're applying to get any benefits from the government. So during the COVID-19, the domestic workers, they were going to the Department of Labor, they were going to the CCMA, but they couldn't get any access to get any service that they were looking for. So the social protection here in South Africa, it is not there for domestic workers. Domestic workers, they are living in the poverty. They are still inequality is there. So now the domestic workers, they are not getting any job. We are trying as Satsau to get in the group. So that's a group such as NGOs, Black Search. We are fighting for that money that the relief first fund that our government was giving to those workers, to those people who are not working. Although today they are closing that fund. So we joined this group to fight government, to give all the workers, all the people that are not working in South Africa, to give them the basic income grant. So we are doing that campaign now with all NGOs here in South Africa. Workers in South Africa are really struggling. When we notice now, most of the workers now are at home each and every day. We receive a retrenchment from the workers. But as Satsau, we are trying to help them so they can get a salary or they can get an income. We are starting to do the projects now, so they can train themselves, they can come with their skills, so they cannot stay without food with the children, because the domestic workers are the single parents. And also the social security. Yeah, there's a lack of social security here in South Africa. We were fighting for the corridor, and the domestic workers are dying. The domestic workers are getting injured, but still, the government is still not recognizing that the domestic workers they must sign the quota for the domestic workers. So in South Africa, we are still behind. But as a union, we are fighting for this. We are doing campaigns, we are doing workshops, so we can educate our workers and we can let them to know what is going on in the sector of domestic workers. Yes, I thank you.
Thank you, Gloria. We know in most of the affiliates of the trade union, domestic workers is one of the sector which was looked down. But all in all, we could see from your presentation that SADAW is trying its best to support the domestic workers, to push, to fight for the domestic workers by lobbying the government. Yeah. I see, thank you very much for the presentation. I would like to welcome Asma. I think she's on, I see she's on. Asma, can you share with us how Guinea Sinem is trying to support the domestic workers and the government in Guinea?
Hello, everyone. As you very well know, the impact of COVID-19 on domestic workers in Guinea and also in other sectors of the activity has been great. And the impact was very strong. The crisis was very strong in association with COVID-19 in my country. And in the
et problèmes que rencontrent les travailleurs auparavant, c'est vu être confrontés
problems that domestic workers have to face. These difficulties are economic, the degradation
type, and also related with the degradation of their working conditions of domestic workers. And also they were laid off. These workers in a large part were laid off. If we talk about social difficulties, their social situations, we can talk about the fear of workers. They were afraid of leaving their homes. They were afraid of catching the disease, of catching COVID-19, and also the economic difficulties. The employers sometimes were not working, and so this reduced in turn the work of domestic workers because they couldn't pay them. Others were forced to stay at home. Others were had made to take like a technical leave, as they would call them, but everything led to a reduction. If the domestic worker was working maybe 8 hours, all of a sudden they had to work 4 hours. And we would tell them, for example, they would tell them, come one day out of the 2 that you were hired to come. So this was a bit the description of the problems, and the degradation of their working conditions was reflected in this way. On the other hand, they were not supported by medical assistance of no kind. The employers would not give them these sanitary kits. They would not give them. So they were most exposed, more exposed than others, because it was their health that was exposed when they went to the market to get the food, or when their employers received foreigners in their homes, and they were exposed and had no personal protection equipment whatsoever. However, thanks to the support of the IDWF and the FDS in Guinea, we were able to raise awareness and provide these sanitary kits and masks to the domestic workers. And this was accompanied by a great awareness campaign through social media, through text messages and trying to face the difficulties that appeared. We also continued to develop these activities in spite of the difficulties.
Notamment en matière de la couverture sociale.
And in terms of the social coverage, there was no maternity leave, no minimum revenue, no minimum income.
De soumission avec cette...
And this situation is really severe and places domestic workers in a situation of vulnerability, made worse because of poverty, because of discrimination, and because of social exclusion, because domestic workers are also considered, always considered, people of a lower class. And you know that very often these workers do not have a work contract, not a written contract at least. In general, it's just a verbal agreement or just an informal arrangement. So all of this made the situation of domestic workers even more complicated in my country. And this leads employers to be able to lay them off as they see fit because there is no written contract. So all of these problems reveal the issues and the difficulties faced by domestic workers in general, and they are subject to all forms of abuse. They might be raped, they might suffer violence, and often they do not speak about it. However, we are fighting to help them leave this place of silence. And in the situation of COVID-19, many of them stayed at home. They were facing violence in their homes. We are helping them speak out. And for a few months now, we have started working with the authorities, with the competent authorities that work on security in our country to reduce these levels of violence, with respect to who are sometimes mistreated in the homes. We were able to take and help many children, and their parents were removed from a situation of exploitation, and we were able to assist them. So we were able to support them in this way. Fortunately, we have the support of the IDWF, and I would like to take this opportunity to thank you and to congratulate you. Awareness is always present, and it is very good work that we share to help domestic workers. I don't want to take too much more time, but I would like to profit this opportunity to wish you a very good International Workers' Day tomorrow, May 1st, for all workers and especially domestic workers and everyone who has joined us today in this meeting. Thank you very much.
Thank you very much, Asma, for your powerful messages. You have shared with us the challenges which most of the domestic workers faced in Guinea, which are similar to other countries, but also the way you used the social media to create awareness about the prevention of pandemic, but also the way now you are taking some good measures to work with the security authorities to protect the abuse for children, but also for domestic workers. Thank you very much. And now I would like to welcome Rosa. Rosa, yeah, we are forgetting to clap for you. Yeah, now we are going to hear from Rosa. Rosa Mbambamba is one of the organizer and official. She's an ex-domestic worker, but also an organizer who is working day to day on domestic workers issues. She's going to share with us how cash grant was used in Mozambique for domestic workers. Rosa, welcome. Rosa, are you around? Rosa Paliche Mbambamba from Synod. Is Rosa around?
Rosa ou algum camarada de Moçambique? Não sei se tem alguém de Moçambique.
Rosa or someone from Mozambique can present. Is someone from Mozambique here?
I've seen her. Rosa.
Rosa, se você está aí, consegue ouvir? Consegue ouvir a gente?
Rosa, can you hear us? Are you there?
Rosa, conseguimos ver você na lista, mas está sem microfone e
Rosa, we see you in the participant list, but you don't have your microphone on, nor your camera.
Nous ne voyons pas votre.
Rosa, you are supposed to speak about cash transfer, which was used in Mozambique. Yeah, here she is.
Rosa, o microfone está desligado.
Your microphone is on mute, Rosa.
Dear colleagues, sorry, Rosa is trying to connect. In Africa, this is one of the challenges, as you can see. We have problem of internet connection. We can see our colleagues from Ethiopia, domestic workers, are waving to us. There are 4 of them. You can see the domestic workers. There are 5 of them. Rosa, are you ready?
It seems, Vicky.
Yeah, Rosa. Yeah, can you share the experience of cash transfer from Mozambique? Are you ready?
It seems, Vicky.
Yeah, Rosa. Is your turn? Yeah. Can you share the experience Rosa. Of cash transfer from Mozambique? Are you ready? Yeah, Rosa, your turn. Yeah. Can you share the experience of cash transfer from Mozambique? Rosa is trying to connect, but it's very, very difficult. It is on and off. Luis, can you talk to Rosa? Rosa is trying to connect, but it's very, very difficult.
It seems it's the connection that's not working. Not sure there is much we can do right now.
I see she's having a problem, and maybe is there any organization which would like to share? Is there any organization which would like to share? Because we see now Rosa cannot speak. Maybe now can go to our end of the program. Before I welcome Asma, if there is any issue, there is a chat whereby you can send your questions and share your issues. And therefore, before I welcome Asma, before I welcome Asma, if there is any question, from the participants, are there any question, clarification from the participants, from our leaders, from our partners? I can see IUF are there, Brother Gabriel, Ajwa. Are there any questions, clarification from the presenters and from the researcher, to the researcher, or any recommendation? Any question, recommendation, clarification? You can write on the chat and we can. There is a question from Rola. She's asking, what would you say was the most important finding of the study? Rola is asking, what would you say was the most important finding of this study? Louise.
Yeah, do you want me to
Yeah.
answer that?
Rola is asking, what would
Yeah.
you say was the most important finding of this study?
If I have to pick only one, I think it confirms something that we had an idea about, but now we have the study to support a little bit, is the lack of protection from governments. So it's one thing to lose your job, it's another thing to lose your job in a context where you don't have access to unemployment benefit, social security, or any type of income support. So I think the key finding is that lack of protection, lack of support from the state, this tiny little proportion who could get any support at all from the state. And I think this is something where the unions could really campaign at national level to get more inclusive social protection policies, because we will face other crises, we will face other waves of unemployment, and we need to have some social protection system in place where that happens. So I think, yeah, that would be the key message. I think the key finding, rethink completely social protection system to make sure domestic workers and more generally informal sectors are included. But maybe comrades from the unions will have another answer to that one.
Thank you very much, Luis. Any addition from Gloria Asma? Gloria Asma or
Hello.
other leaders? Yeah.
Yeah. What I want to say thank you to the IDWF and also to Mama Vicky to support the domestic workers of South Africa. And then also we can get our workshops and do our educations to the workers, so the workers can be strengthened more to know their rights in South Africa. Although it's still a long walk to freedom, but we will reach it. We will not give up. We will go out and do campaigns and do and participate to the women organization, so we can know more about the struggle of the workers, especially the domestic workers. Thank you very much.
Thank you very much, Gloria, for your contribution. Maybe if I can go to Ruiza's response, I think she has noted down, pointed out a very big thing which has been recognized in this study, the social protection. Most of the countries are showing social protection, occupational health and safety, social security. And that's why this year, 2021, and from May Day, the campaign is on social security, social protection, mainly focusing on social security. If you see, the banner is about social protection. It is at global level, but also going down to Africa region and other region, we are campaigning for social protection for domestic workers. They are not recognized in the policy. But also another thing which has been raised by Gloria is about what should the union do? What should the union do to continue educating, creating awareness to our members? But also campaigns. South Africans are very good on itoitoi, on campaigning. They are not afraid. Therefore, we need, in order to get our right, we have to continue campaign for domestic workers, including social security. Thank you very much. Any other question? Any from President? I see President Mato.
Yes, I just want to say again a special thank you to Louisa. But what I would like to say, we must take all these resolutions in our country, throw it up in a campaign, and really go and present it to our governments to take action and to assist domestic workers. I think we cannot lose the value of all this research that was done because it's so great, it's so powerful, and let us do it and let us go and let us take one day in Africa to say, this is the day that maybe we can do it in August or something, that we want for all our organizations in Africa and the world. And that is what we should do, not to lose this research that was so powerful and that was done by domestic workers. Thank you, Comrade Vicky.
Thank you very much, Mato. I think now this is a directive. We need to find a day, identify an issue or issues from our research, and make a big campaign to voice up as a region that we would like government to do 1, 2, 3, 4 for domestic workers. Thank you very much. There are just comments. Nelly from Dow is saying that especially the compensation benefit for domestic workers. She's raising another point that we need compensation benefit are not happening to domestic workers. Okay. There are 3 more who are raising up their hands. Can you write? Can you write? Can you write down your comments or questions? It is from Met. We are nearly to close.
Yeah, can I speak?
Yeah, Elizabeth, yes, welcome.
Yeah, congratulations to the report, which is very, very informative, that really expose all the challenges faced by domestic workers. And Gloria and Asma are doing so well to present the situation of domestic workers in the country under the COVID. As you know, the ILO is conducting a survey about the C189. And the IDWF, we will discuss this with you in 2 weeks' time. And I strongly recommend you to use what you have found out in this COVID research, also to reply to some of the questions of the ILO survey, because what you have discovered or what you have found out in this research are first-hand information, fresh from the oven, so to say. And they are very, very important for the ILO, for the governments, your government and governments internationally to hear this. So when you do the survey of the ILO, please include what you have found out in this research. Yeah, that is my strong advice. Thank you.
Thank you, Elizabeth. I can see there's an ILO representative here, Gertrude Sima from Tanzania. I think she's hearing what you are saying. There's another comment or question from Achayo, a domestic worker from Uganda. She's saying most domestic workers are not given insurance at workplace. So what can IDWF say about this? Is there a question? Most domestic workers are not given insurance at workplace. What can IDWF say about this? Who are IDWF? This is another education. IDWF is us all. Are the affiliates? Are the affiliates? Are the unions? That's why we are saying, first of all, we need to know what are domestic workers' rights. Domestic workers' rights, you need to know, domestic workers, they need to know what is your right. And Convention 189 says what are the rights of domestic workers. But also, and this includes social insurance. We are talking about social protection. Therefore, as IDWF, we can support you technically, like what we are doing now, giving you skills on how to lobby, how to campaign, giving you education, sensitizing you about what are your rights. But the other thing is to campaign for ratification of Convention 189. We've been supporting you ever since, and we are still supporting you. But the only thing is now for domestic workers, after being skilled, after getting all the education, to make sure that Convention 1 is being ratified and then adapt it to the country's regulations or laws. IDWF will provide you support, and we can join hands with you. Gertrude Sima from ILO, thank you. She's saying, she's from ILO, she's saying, thank you for organizing this forum and for sharing the report on domestic work, which is very informative. Please share the report with us and we will circulate to colleagues and other UN agencies in Tanzania. Let's keep our collaboration active for more work. Thank you for inviting me in this meeting. I've learned a lot. I think, Sima, you have many circles. It's not only Tanzania, but I think we expect you to circulate this report to other ILO colleagues at regional level. Yeah, thank you very much. Yeah, we are coming to an end of this session. We thank you very much. And I would like to emphasize on what our president said as leaders from Africa region of domestic workers. We need to use the resolutions. We need to use this research to turn them into activity. This research should be an action oriented. We can start from tomorrow, which is May Day, to demand for our rights, to showcase what has happened during COVID-19 to domestic workers. It has we have facts from this report. Therefore, it is a very good report, as General Secretary say. It is coming from the horse's mouth. These are the response, or the research is coming from the response of domestic workers, leaders and members who experienced some challenges during this COVID time. Therefore, use it from tomorrow. We have already circulated the posters which are emphasizing on social protection as well as social security. At this juncture, I would now like to invite there is a question on question and answers. A question about ILO. Hi, Vicky. Thank you for organizing your useful panel. Is there a link to the ILO survey that Elizabeth is mentioning? We can share with you. It is coming from Clara. We will share with you about the survey. Yeah. Elizabeth, would you like to answer on this? Elizabeth, there's a question from Clara. Is Clara from ILO? I see Clara from ILO.
No, I was just sharing the question that's displayed on the question and answer panel,
Okay.
but it comes from Arnesian.
Okay, thank you. Thank you. At this juncture, as the regional coordinator, I would like to thank you very much for the good participation. Yeah, this was a webinar, therefore it didn't allow many people to speak up. It was just to write, but next time I think people would like to speak up. And therefore I would like to invite Asma Bai, who is the member of the executive committee representing Africa region, to close the meeting. Thank you very much and welcome, Asma.
Merci de m'avoir donné la parole.
Thank you very much for giving me the floor, and thank you very much to all the participants of this virtual meeting. This has been a very important meeting for us, for the representatives of domestic workers in Africa and for domestic workers in general, of course. This topic is throughout the world a topic that has been deeply affected by COVID-19. Each person in the world wishes COVID-19 to leave this world, to be eliminated, because the pandemic has put a stop to the world as a whole. So we need to work together, and it has affected us all. And we need to work to eradicate this pandemic, because we can do anything without our health. We cannot do anything without our health and our safety. And domestic workers, of course, their health and their security is at risk in their workplace. So we need to work to eradicate the pandemic. Our Secretary General, Elizabeth, has said this, because if we work and we use these findings, and also what Vicky has said, and Myrtle also, I think these are very good advice and very good information that we need to use. This is really, really excellent. And I think that after this meeting, of course, they're going to share this report, and this is very important for us to continue working on it.
C'est ce que je voulais
Much
dire.
to everyone. This is all I wanted to say. Thank you very much also for the participation, and have a good day tomorrow. Have good Workers' Day. Solidarity.
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 Forever. Solidarity. Forever. Thank you very much. Again, we thank you very much. We will share the report now to all our affiliates and partners for use in our respective countries and the other partners. Thank you very much. Bye. Bye.
Bye-bye.
Bye-bye.
Testing, testing, testing.